my esteemed pleasure today to welcome a dedicated obstetrician gynecologist, Dr. Leslie Farrington. Hello, Dr. Farrington.
Hello, Dr. Rahman. Thank you for having me.
I should add that the doctor has retired, but has then entered the second phase of her career, and she is now the executive director of the Black Coalition for Safe Motherhood. I don't want to be indelicate, but I do want to raise the issue that you don't look Black.
And I usually start off, and I was about to introduce myself. I was going to say, have you seen a picture of me? Because people are always shocked when they see me because I stopped putting pictures up because I wanted to just show the logo. But what I do whenever we start a program is I show a picture of my father.
That's your father. Okay.
That's my biological father. Okay.
How do you maneuver through the world as a Black person when you don't look like a Black person? And then I have to.
Yes, it's true. It is very personal and it is very painful. And it is something I have recognized. I know that my lived experience is like a unicorn's experience because I do experience everything, you could say vicariously, but it's almost like what I feel inside is not the way I look. So everybody I'm with is experiencing it. My sister almost died twice. I have enough. And then growing up with my parents, I experienced it almost daily because it was a daily topic of conversation, almost daily with my parents, the experiences that my father had, that they had. I was eyewitness to the discrimination of an interracial couple.
If I'm
And yeah.
if I'm being inappropriate in any way, shape, or form, please speak up. That is not my intent. Did,
No, it's
did
a,
you
it's I think it's therapeutic, and I like people to understand. Just because I don't have the lived experience, and I'm an obstetrician, that's why I had a whole lot of people put this program together. I'm just the person who's running the organization, but I do not facilitate the workshops because there are certain it just doesn't look right. It doesn't feel right to the people who are
interesting?
participating.
You don't
But
want your
not everybody.
you don't want your face to be the face of this program.
Exactly. And I did not want to start the organization either.
Inter-
I did not want to, but I could not find the people who I came in contact with. For example, the head of the Long Island chapter of 100 Black Women, she started to champion ACT, but then she dropped it, or organization dropped it. I reached out to the NAACP.
if
Sorry
I
again?
Did you ever consider my life would be so much easier if I just went through life as a white woman?
Oh, no. No,
No.
I only think that my life would be so much easier if I looked Black. And I lament what I look like, but I know that I have to keep doing the work I'm doing because I'm very passionate about it, probably because of my experiences.
It's not every day that you can hear the lived experience of someone who doesn't look Black, but who is Black. And there's probably pros and cons and negatives and to which I don't necessarily relate to, because I've always looked Black. I've always been perceived as Black. No one has ever said, I wonder what that took and why you would choose to do that is all fascinating. And then to see that your life's work becomes dealing with racial health disparities, it's just a very rich. rich topic, and I think we could probably go on.
It's mind-boggling. I had one friend tell me, Leslie, you can keep doing this because look at the story of Walter White. Walter White also looked white, not because of interracial parents, but because of, the colorism and all that led to his family being all very white looking. But they identified as black. Unlike other people of the time, at the beginning of the NAACP, he was, for many years, I think the president or whatever it is, the title at that time, and he used his white presenting phenotype to go undercover and do stuff on behalf of the NAACP. So I gained solace from him as I remember that woman that you talked about, whose name I've now forgotten, who's in the Pacific Northwest. I forget. Which is good. I'm glad we're forgetting her name. That's okay. Anyway, so knowing about her made me say, okay, I've got to show a picture every time to say that this is why I identify as black. There's no choice in the matter. I
Okay.
had no choice in that matter. This was not even a,
Can you share your story with me?
of course, my father was a dark-skinned black man. My mother was a blue-eyed white woman. Uh, they married in the 1950s when interracial marriage was illegal in many states. And my father uh, raised me and schooled me as a black person, identifying as black, and explained to me why I am black despite my presenting as white. He said that those freckles on you, that's me in you. Because people would ask me about the freckles, people would touch my hair and say, "Oh, you got good hair."
Mm.
Except for my mother, I was always in a black community. And yes, other kids would say, "You're not black." And that made me socially kind of introverted or excluded. And I self-excluded after a while because I didn't want to go through that. And so that's why I really never thought about passing or any of that. I mean, my siblings are black. Everybody, my children are black. Everybody out around me is black. And if I ever write a book, it would be, the title would be, "Are You Together?" So everybody around me is black. It looks like I'm not with them, but I am there. And my lived experience is not that of my sisters, but I lived it vicariously, and I have seen from my medical career how I've overheard white people say things that reveal their bigotry, and because they didn't know I was black, and that's so I have a different experience of racism, but I have plenty of experience dealing with racism, and the trauma does impact me as well.
Now, earlier you showed me a picture of your mother and father. Could you raise that up again, please?
That's me and my father.
Oh, that's you and your father. Oh,
That's me and my father, right? I have a picture of my mother and my father.
please.
Um, that's them.
And your
Can you see it?
siblings. You mentioned you had siblings.
Oh, yes. Well, let's see. Um, I'm going to cover the face of the one who does not like to be seen in social media. That's me with my siblings.
All five are your siblings? I mean, you and your
Right.
siblings. You have four siblings.
I have three sisters and two and one brother. Yes. And
So your siblings are a wide range.
right,
You have
right,
a sibling that looks as dark as your father,
right,
and then there's you, who I
right,
imagine is closest in complexion to your mother.
right. I look a lot like my mother, but I do have some of my father's features. Hmm.
Wow. So I imagine
Yes.
That's hard. That's hard because you're saying, I know I'm Black because my father told me I'm Black, but I'm
And
not.
because I'm his daughter. And we know that if I married a white person, this is one of the ways he explained it. If I married a white person, my children can be brown.
Right.
So, and obviously black, even though I don't look obviously black. I have the genetics and I have the culture. I
Yeah.
have the upbringing. Right. So, like at parties, sometimes, people will say, "Oh, she's got, she really dances unlike any white woman I've ever seen dancing." So yeah, I don't have, and I have a lot of experience of racism, but I know my that people perceive me differently, and I use that in certain settings. To advocate for my husband in the healthcare setting, for my sisters, and whenever I'm in person in those places, and that's what we really hope to get into is how to advocate and why advocating is important. But that's a whole nother story, but my why I am so passionate about addressing the injustice of racism and paternalism in healthcare is because of my experiences of racism and injustice as growing up. And my father always involved me in all the conversations about that from a young age.
So I would imagine that as a child growing up, you did not experience racism because someone looking at you, a non-family person looking at you, would say, this is not a Black person. So you wouldn't be treated like a Black person.
Well, I was excluded from the local Catholic school because my parents went to enroll me and they saw my father and they did not take me. So being with my father meant that we experienced racism.
Mm-hmm.
Now, if I was with my mother, right, but you're not always with your parents. You're with your siblings, and so it wasn't so difficult as a kid, except for the extra attention to things like straight hair and freckles and things like that. That I felt uncomfortable for that my neighbors were looking at me like I was something strange. But my father reassured me about that. He said, "Those freckles are me in you." So I became proud of my freckles.
Mm-hmm.
And my hair was curlier when I was a kid. I used to wear it into my best version of an afro that I could. So I used to have curly hair. It's kind of strange that went away, but that was as a teenager, I used that. I went away to college at an early age because I had no social life as a teenager. I went away to college and embedded myself in a small group of Black students at my college in the 70s. In order to have that cocoon of belonging. And I was welcomed and supported, in that setting. And that was very helpful, a good way to launch into motherhood and eventually medical school, etc.
So the isolation you felt in school, elementary, junior, high school, was as a result of looking like a white person in a Black school?
Right. In elementary school, it wasn't. I didn't feel that much. I was there with my siblings. It was not a situation that was uncomfortable. I had friends. You have intimate friends as a kid who accept you for who you are. So I had some friends, but when I went to high school, I went to a predominantly white high school, and the few Black students that were there did not recognize me and did not include me. So that's when, and at that time I was reading. I was basically reading. I was reading the autobiography of Malcolm X. I was being radicalized through my reading, and I even reported one of the teachers for a racist talk that she gave in one of my classes. And that teacher was fired because my parents went up to the school to report on her uh, just stereotyping of, it was happened to be Eskimos, something about Eskimos. I don't even remember now. So I was already becoming an activist in high school, but it was a lonely place because there were hardly any black students there, and they were not from my elementary school. They were from some other elementary school. And so I didn't have any friends in high school, but I made up for that when I went to college. Yeah.
I think you touched on this briefly. It seems as though it would have been easier, your life would have been easier if you just went through life as a white person.
Yeah, that was never a question, not something that would ever have occurred to me the way I was raised.
Okay.
Never would have occurred to me. I probably didn't even know about passing per se at that point in my life. I started to learn about it when I went to college in the Baltimore, Washington area,
Okay.
where I think there's a lot more colorism among Black people. So yeah, I started to learn about all of that. Somebody called me High Yella for the first time when I went to college. Um, yeah, it's been strange, and probably should write a book about it, but not while I'm doing what I'm doing now.
Right. Okay. Would you agree that racism is based on someone's interpretation of you, your external appearance?
I wouldn't say it's racism is an interpretation of me or my appearance. No,
No,
there's no racism in looking at me and assuming I'm white. That's just, that's what I look like. I look like I'm white. I understand it. My husband says, "Oh, you don't look white," but I don't know what he's seeing. He just, but yeah, I do. I look white. One of my sisters, you might say, "Oh, what is she?" A white person might say, "What is she?" But Black people know she's Black. Sometimes Black people know I'm Black because of the way I talk and what I'm talking about, and but most of the time, nobody could tell that I'm Black. And
so
that's just, and they could deny it all they want to themselves, but they can't change my identification of myself or the way
right.
I feel inside.
So my point was then because you look like a white person, you haven't experienced racism.
Oh, that's not true either.
Explain that.
Because when somebody says something that is bigoted, I feel that sting. I feel that when they pulled us over once up in Harlem, my husband and I were going to an event, and the police pulled us over. And when I rolled down the window, the officer said, "Oh, I thought he was driving." And I felt the same chills and fear that I would feel if I was looked different, that because I felt like we were being treated the way my husband looked.
Almost like
But we get,
an indirect experience. I mean, you personally haven't experienced, I mean, you may
well,
have,
I don't know. You can argue that, but I've when you're a child with your parents riding in a car, and you're getting racial epithets yelled at you, or people staring at you, you feel the same thing that your parents are feeling.
okay,
So
okay,
yeah, for me, it is an experience of racism. It may not be exactly your experience of racism, but yes, I experience it that way, and I experience it. Um, I feel secondary trauma also from just hearing stories, and I don't think I know I don't feel them the way a white person would feel them. So it may be some in between kind of thing that nobody can measure. But yeah, so yeah, I would say yeah, I've experienced racism. It just may not be the way some other people will have
okay.
experienced it.
I can understand that. Given the way you look, have you ever gone, for lack of a better term, gone undercover to be in a group of white folks and to experience how they talk about Black folks.
Yes, I would say not intentionally, but it just so happens that that occasionally, and not that often, but occasionally I would overhear. This is when I worked on labor and delivery. The nurses, mostly nurses, because that's who was around on the nurses station, would say things about people, somebody who was in triage, for example, or in the labor room. They would say, just make disparaging or disdainful remarks about, oh, you know how they are, or I could tell they were bigoted. There, and then segregated Long Island, most white people are bigoted. They have all those stereotypes in their head. They don't live around. It's a very segregated place, Long Island, in New York. So yeah, you can overhear people saying things, and I've heard patients say things, and sometimes I would challenge them on it, depending on how blatant it was. But usually, I was too busy to try to address, injustice in the moment, unless it was, very obvious. I never had an occasion because I was not. If it was my patient, so I only know what's happening with my patients, not with other people's patients. So.
All right, so you go to college, you go to Howard University, correct?
I went to Johns Hopkins for undergrad, and I
Okay,
went to Howard several years later for medical school.
Howard's Medical School.
Right, right. But I was recruited to go to Hopkins a year early because they had early admissions by a black graduate student they had asked to help recruit black students because they had so few, and they just decided that they were going to start to admit more black students. So that's how I wound up at Johns Hopkins. One of my mother's friends had a daughter who was a graduate student there, and I'm still friends with that graduate student today. She's anyway. So that's the connections I made back then, 50 years ago, are still very strong because that was a very tight knit, small group of black students at that time.
Would you say that Black people can be racist to each other?
Oh yes, oh yes, and I saw a lot of it there in school. So even though we had a close knit group, you would hear them, the light skinned ones, say, just like somebody said hi, yell it to me, somebody else would say darky to one of the dark skinned ones. So I saw all kinds of stuff that I hadn't experienced before. It was like black folks from different parts of the country were coming together.
Mhm.
And even though they were grouping as a group, like almost like a family group, they still had this, colorism, the stereotypes, all of that was still operating. Yeah.
What made you decide to go into OBGYN?
Oh, that's a really interesting question because I wanted to be a midwife. So what happened was, of course, I was a lonely kid going into it. I wound up marrying one of those friends in school and had a baby right away. And the clinic that I went to, and I was late to prenatal care because I was working in the library at $2 an hour, and that was too much money to get Medicaid until the summer was over. So at 7 months pregnant, I went to be run by young males, young white males, and I just couldn't stand that clinic. I saw that so it was like medical students examining me, residents, whatever, and I saw they had women running another clinic in the same area, same, Medicaid clinic area. They were student midwives. So I wound up seeing them, and a midwife caught my daughter, and she influenced me. It was an epiphany, the experience of having this woman's face in my face, breathing with me. Basically, I did not experience any suffering. I must have felt pain, but my labor, I do not recall the pain of that. That experience made me feel that I wanted to support other women doing what she did. I wanted to support women this way, to make birth this kind of experience for others. And I had never had any intention of going into a healthcare profession at that point. My mother was a nurse, and I was disgusted by nursing, and I didn't like science or math.
Oh,
But at that point, I said, you know what? I want to be a midwife. And I told my husband that, and he said, you don't want to be a midwife. You won't be able to get a job. He had been pre-med since he was 8 years old, a kid from a poor neighborhood in Baltimore. But his physician, he had a black physician growing up. So he had become pre-med from like age 8. And he already had an impression about midwives as a 19-year-old in college. He said midwives won't get a job. That's how awful the OBGYNs were with eliminating or virtually eradicating midwifery in the United States. That's another thing that really
that's
gets
another
me
thing.
riled up.
Yeah.
Yes, that's all. I could go on about that forever. The trauma, the harm that was caused by that is one of the most tragic things that happened in the United States, and certainly the most in terms of maternal health. Anyway, but that's another, like you said, that's another topic.
So this was a home delivery with
No,
no,
no, it was at the hospital.
it
It
was
was
at
at the
the,
hospital, but the midwives had their own program. They had a midwifery program at
right.
Johns Hopkins at that time. And so I went to that because I didn't want to be seen by men. You could say I started advocating for myself when I was 18 years old, you know. So that's why, but then I said, well, I'm not good at science. You know, I can't go to medical school. I'm not good at science. So at first I wasn't going to do anything about that, but eventually, 8 years later, I did go to medical school. I took a few courses. I did pretty well with the courses, but I found it too arduous to be raising a baby and going to school at the same time. I found that I just didn't want to deal with that. And so when I graduated, I said, you know what, I don't know what I'm going to do, but I can't go to medical school because I can't deal with these courses and take care of a baby. So I just decided I'll have one more baby because I don't want my child to be an only child. And I was a housewife for like 5 years while my husband went to medical school.
Oh, wow.
And then I said, I don't want to be a housewife either. So I started taking pre-med classes again and eventually went to Howard.
So how old were your children when you entered medical school?
2, 4, and 8.
Oh,
Yes.
that's admirable. That's a lot of work.
And my husband was a resident at Walter Reed Army Medical Center. He had to join the Army to support us while he was in school and all that. So, yeah, so it was like, I was just determined. I said, I can't be a housewife. I just did not want to be that. And I knew that I still wanted to support women having babies. So that never left me, that interest that way. So when I went to medical school, it was to become an obstetrician. And I didn't know what that meant. I didn't know what was really the difference between, I knew that obstetricians could do C-sections, that we would be doing, I would be doing surgery, GYN surgery, and, you know, medical school got me interested in all of those things, you know. And eventually I excelled at it. I actually completed a 3-year program that they had at the time at Howard because I wanted to keep up with my husband, who was a year ahead of me. He was doing a 3-year residency, so I wanted to do medical school in 3 years also.
You were able
So
to complete medical school in 3 years.
they had a program. It was called the shortened curriculum at that time. It was in the
Okay.
80s, early 80s.
Oh,
And they worked through the summer. And we had a babysitter who lived with us. that and my quality time with my kids was to braid their hair in the evenings. That was the way I that had quality time with my children. That was always the time to sit with them. And yeah, because that medical school was quite demanding, and so is residency. So all through that, I think that the kids were um, that I was not the optimal mom for them to have. I can say that. That's my one of my regrets. Um,
And did any of your children take after you in terms of looks?
the youngest used to think she was fairly light skinned, but they all look black. Yeah. Um, let's see. Here's me with one of them.
Oh, yes, yes.
Uh-huh. They're brown skinned and they don't look like they don't belong to me. And that was a big deal for them growing up. Especially the youngest, because she didn't like the fact that people would say, "Are you together?" She
Mm-hmm.
would be angry about that.
Mm.
Yeah.
Where did you do your residency?
At Long Island Jewish Medical Center and Queens Hospital Center, so a community-based hospital and a community hospital and a city hospital in New York City, where I grew up, where my grandmother died. My grandmother died of a pregnancy complication at Queens Hospital Center. And
Really?
so I wanted to be back in the community. I wanted to, they say, give back to my community. And so that's where I wound up for residency.
And how many years did you practice OBGYN?
I practiced OB for 20 years and then just GYN, office gynecology, from 2009 to 2016. I set up an office in my home, and because I did not like the time pressure of working for the hospital and having to see so many patients in a session. And I mean, they were really cracking the whip, I like to say. They were cracking it. I felt like this is volunteer slavery to work for this major system. It's a system that it was a Northwell, it was what became the Northwell system, healthcare system, which is the biggest healthcare system in New York. And so they had faculty practice. I was in the faculty practice almost the whole time. And so they wanted you to make sure you brought in enough money to support the office. And so it was a lot of time pressure. And I grew out of that. I grew out of that by learning about medical error and how doctors were misdiagnosed people around 15% of the time. So I
Mm.
started to learn about medical error, and then I realized that I started to recognize the power differential, the poor communication, the interventions in obstetrics. I started to see everything more and more and more, and the more I saw, the more disappointed. It just, and it has grown. These things have grown. My awareness of the evils of the system have grown over the years. I don't know that there's any more horrors that I could learn at this point.
So your dream was to be able to deliver babies and to give women the same kind of experience that you had with your first child. Were you able
Right.
to do that?
Oh yes. Oh yes. People. There were a few doctors there who would call me names because I was so patient. There's a Yiddish term. One person said, because I was waiting, I was giving some person more time to push or labor or whatever the case may be. And he called me a schmuck. He said, chances are she's not going to deliver vaginally. You're a schmuck for waiting, But there was one woman there. And so that one thing that she said kept me going, to be resistant to interventions and honoring what women preferred. And some of the things I experienced though were horrible, because it was to wait and to let someone and to encourage someone who was having difficulty attaining a vaginal delivery that they wanted. Sometimes there was some trauma. There was trauma involved, and sometimes it was for the baby. Sometimes it was me experiencing the trauma of waiting and the fear of it turning into something terrible in the end. So it's not easy to honor the patient's desires and preferences in the system, because you've got people standing over you, people coming running into the room saying, look at your tracing, the fetal heart rate tracing. Aren't you going to do something, or what are you going to do, this kind of thing. And I'd have to say, wait, watch. I would so I definitely had a different example for the residents to go by, but I did get some criticism, so for
Just
that.
for someone listening that might not follow, I should say that once a woman enters into what we call active labor, the expectation is she'll dilate at a certain rate. And if she dilates at a certain rate, if she's 4 centimeters dilated, we expect her to be fully dilated at this particular time. And so
Right,
we are trying to plot this course. And while we're waiting, we're tracking the frequency of the contractions and we're looking at the fetal heart rate. And so
right,
when any of those things go awry, it's taking too long, she's not contracting well, we're concerned about the fetal heart rate, you have to make decisions along the way. Do you intervene, or do you or do you give it more time? And so
right,
you were saying you were of the mind that you're trying to give this woman and this baby the benefit of the doubt to allow them to have a vaginal delivery.
right. And to not intervene, not cause harm, to honor their preferences. That was very important to me, to honor the person in the bed's dignity and autonomy. And I didn't call it that at the time, but
Mhm.
I was someone who was practicing person-centered care.
Mm.
And it's not that I was ever taught it in medical school or anything like that. It was not something, it was like instinctive. I did not know anything about birth justice, reproductive justice when I started out. And when I started out, it was the mid 80s. And the reproductive justice movement didn't start till 1994 per se, wasn't called that. But anyway, so yeah, so it was harrowing, and I guess you could say I got tired, and so I retired from obstetrics for multiple reasons. And when I was in my 50s,
Were you in a group practice or did you have a solo OB practice?
oh, it was a group faculty practice,
All right.
right? There was a group of us who would take turns being on call,
So
and
your partners didn't necessarily practice the way that you did.
right, that's
And
right,
so that's pretty much the way things are now. It's rare to find an OBGYN that's doing obstetrics that's by himself or herself. So
right,
when you identify an OB doctor, you're really joining a group practice.
right.
And so I'd imagine your partners didn't necessarily appreciate the way you were practicing obstetrics.
Well, some may have. I think we were gracious to each other in our different modes. Nobody was very aggressive. We were not aggressive with C-sections like some groups are. Like we were more of a less intervention group overall, and
And if a
So yeah.
woman came to you and said, I want you to deliver my baby, would you do that?
Occasionally I would try if I was in the hospital, but if I wasn't on call, I don't recall one time that I went in for someone other than maybe my partner's wife. So yeah, that just didn't happen much. No,
Were you the only female OB in your group?
no, we only had one man in our group
Oh,
of like six or seven,
oh,
right? And when I was in the latter years of my time at that hospital, we mostly had women residents, and there were a lot of black women residents too. At towards the end of my career, and I think that was because we had a woman as our chairperson also.
mm.
Um, yeah, so yeah, so it was mostly women in
And
in our residency program.
what about the demographics of the patients that you saw? Were they um, primarily Medicaid? Was it Medicaid and private insurance? Was it primarily private?
Private, private insurance. We had no, we, in the faculty practice, there were no Medicaid patients.
No
It was in the
Medicaid.
clinic, but we supervised the clinic where
Oh,
the residents saw the Medicaid patients. And that was a horrific space where people would line up at 8 o'clock in the morning to be seen anytime between 9 and 12 or 1 o'clock. So, and then they would line up at lunchtime again for any time to be seen. That just horrible. I checked about 8 years ago. It was still like that. That they would herd people like cattle,
oh,
and
yeah.
that care for clinic patients, people on Medicaid, was not optimal in my opinion. Yeah.
Yeah, my understanding of this kind of system is that you were an attending physician. So you oversaw the residents who are doctors in training,
Right.
take care of the Medicaid patients. You,
Right.
as an attending, didn't see Medicaid patients, you had private commercial patients.
Right.
So that's when we start to see disparity in healthcare.
Segregation.
You can hear more about the work that Dr. Farrington is involved in part two, and how her lived experiences have shaped her and provide direction as she became the founder, co founder, and executive director of the Black Coalition for Safe Motherhood. I confess that her personal story, her lived experience was fascinating, and I hope it provides us with a greater insight and understanding. Stay tuned for part two.